Look familiar? Have you noticed maybe your child has outgrown the pediatrician? Is the age gap between your teen and the other patients in the waiting room significantly different? How about those special moments during the weigh-in? Remember them? Perhaps not as special now. It's time to prepare your older child for the transition to an adult provider.
Hey Brian, how you doing?
Hi, how are
Hi,
you?
Mom.
It's good to see you again.
Good to see you too. So how are things?
Things are...
He's doing very well. He's actually getting good grades at school, and he's looking at several different colleges around here.
Oh, that's great news. What colleges are you interested in?
I was thinking of going...
He's actually thinking about staying home with us this year and looking at the community colleges around here. And the good thing is, we can still keep coming to you, since you've known him since he was a baby.
Well...
Mom, this is uncomfortable. I wanted to ask the doctor some questions in private about myself. Do you mind?
Your child is growing up and moving toward adulthood, and sometimes it's not easy for them to talk about serious topics that could be personal. This is a family decision, and transitioning to adult health care can and should be easy. Start by being on the same page. Let your teen lead the discussion and help guide them on health care. Remember, your physician is here to help both of you navigate the transition.
Here you go, Brian. This is our transition checklist.
It's obvious my Brian is growing up. I guess we need to schedule an appointment. Actually, I guess you need to schedule an appointment. And there's several things on the checklist. We can talk about this when we get home. Is that okay with you?
Sounds good to me. I'll give them a call when we get home.
Okay.
And the transition checklist is really just a way for us to review several different aspects of transitioning to adult care. And we can talk about it at your next appointment.
Great. I guess next time I will listen and you guys will talk.
Sounds like a plan, Mom.
So how can you help your team with that transition?
How do you know when your teen is ready to move to an adult provider?
What are the steps to transition to adult care?
Begin the discussion with your child when they're between the ages of 12 and 14 to help prepare for independence. Be sure to include both your teen and your provider in the discussion. Come prepared with questions on how to manage medical needs, appointments, medication, records, and insurance. To schedule a transition appointment, call your pediatrician. And to download the Children's Hospital of San Antonio Transition Checklist, visit the link below.